To understand the world, you must first understand a place like Mississippi. What I think William Faulkner meant when he said this was that to understand the world, you must first understand a place like the Mississippi Delta. We consider ourselves our own state. Yes, it is very true. The Mississippi Delta is a different world. Welcome, and this is the presentation of the Adult Wellness Lifestyle Clinic that is going to be based in the Mississippi Delta. Throughout this semester, the group that has been working on this project is Sarah Adams, Amanda Armand, Christina Bassett, Kelly Borland, and Lainey Brock, which is me. Throughout the presentation, you will also have the privilege to see some photographs that have been taken by me around the Mississippi Delta and the place that I have the privilege to call home. The clinic will be located in the Mississippi Delta, but more specifically, we're wanting to locate our clinic in Bolivar County. Our clinic will be seeing women ages 18 years and older of any ethnicity and race. Also, we will be seeing any socioeconomic status, but we know being in the Mississippi Delta, the majority of our clients will be of the lower socioeconomic class. Some of the financial hardships that the Mississippi Delta faces are the lack of jobs, the lack of education. 5 of the 10 districts in the Mississippi Delta area have the highest dropout rates. And then 46% of the children living in the Mississippi Delta. The microsystem in this clinic is the Mississippi Delta females. The macrosystem is the clinic and the interdisciplinary team providing care to this particular population. The mesosystem is including patients that we're monitoring the current and the end results while accounting for certain variations. Because we are in the Mississippi Delta, we know that a lot of our women are going to be coming in complaining of obesity and not being able to get the weight off or keep the weight off. Our main areas or main causes of obesity in this particular area are hypothyroidism, menopause, depression, stroke and hypertension, and type 2 diabetes. We hope to mainly focus on how we can help these women modify all of these disease processes and how we can get them back to a healthy. A point that we're going to need to really stress to our clients and highlight the main reason and the great reason to get their health and their obesity under control is because of the high costs that it does bring into their medical care cost. The Center for Disease Control reports that medical costs for a person that is obese is an additional 1,400. The social and behavioral determinants of this population include the availability of jobs, the education that is provided, the healthy foods that are available, social support and interactions among family and friends, crime and violence in the area, and segregation, also including diet and exercise and substance abuse. The interprofessional healthcare team at our clinic would include the family nurse practitioner, the adult nurse practitioner, the registered nurse, the medical doctor, the dietitian, and the counselor. The family nurse practitioner and the adult nurse practitioner would be the primary care providers and will allow a great connection between our patient. The advanced practice registered nurse that will be at our clinic will specialize in endocrine disorders, including diabetes prevention, care, and education. This would be the family nurse practitioner as well as the adult nurse practitioner. Some of the programs that we hope to obtain grants from for our clinic are the Mississippi State Office of Rural Health that assists rural clinics in getting federal grants for research, recruitment, and support. Another organization is the operational budget will be $500,000 a year with pro bono work from a physician, negotiated rent from a church, and secondhand equipment from other hospitals. Accepted methods of payment will be Medicaid, Medicare, private insurance, and self-pay. Innovation, what makes our clinic unique. This slide and the slides following will give a little bit more information on what makes our clinic unique, but I want to point out that we are a female clinic in an impoverished area that is not commercialized or franchised, and we're rooted in a community. And we're not just basing it on losing weight, but we're also offering services that allow women counseling, emotional. Findings from a 2009 pilot study affiliated with the Lower Mississippi Delta Nutrition Intervention Research Initiative suggested an innovative food delivery medium along with a nutrition educational program conducted in the community may be an economical and effective approach to prevent weight gain. What they found in this study by providing participants with fruits and vegetables and information on how to prepare those foods, as well as physical activity information, was that doing providing an opportunity for people to interact and get involved in their health was much more effective than just providing somebody a piece of paper to take home and read. So not only did the interventions prove effective for the participants, but they were taking it home to their families as well. Another method that was shown to be effective in the Mississippi Delta among rural African Americans is a faith based community intervention. A community based approach can inform the development of programs for African Americans that incorporate socio-cultural factors associated with obesity in the context of addressing health disparities. This community requires cultural sensitivity and the primary use of health informatics in our clinic would be to monitor patients' goals. The EHR is an example of health informatics in place at our clinic. It would also tie into reporting each quality and safety measure. A more clinic specific use of health informatics would be utilizing scales and glucometers that automatically transfer a patient's weight and blood sugar into their health record, thereby reducing the potential for incorrect. The Rural Health Clinic Service Act of 1977 was enacted to address an adequate supply of physicians serving Medicare patients in the rural area. It also provides an incentive to increase access to rural health care by granting advantage reimbursements of Medicare and Medicaid to RHCs that deliver primary care in rural areas and meet the criteria specified in. The PHSA was amended with the passage of the Patient Protection and Affordable Care Act of 2010. Section 4103 of the ACA expanded coverage for eligible Medicare and Medicaid patients, allowing for an annual wellness visit to include health education or preventative counseling services or programs aimed at reducing identified risk factors and improving self management, or community based lifestyle interventions. There are at least two sections of the ACA that addresses grants for which the Adult Wellness Lifestyle Clinic may be eligible. Section 330A-1 stipulates that you may be able to receive a grant if it is nurse practitioner ran. Also, in Section 4108, as long as you provide the needs of controlling or reducing their weight, lowering cholesterol, lowering blood pressure, and avoiding the onset of diabetes, or in the case of a diabetic, improving the management of that condition, you will be able to receive this particular grant as well. That will end the presentation of our Adult Wellness Lifestyle Clinic in the Mississippi Delta. I hope you enjoyed listening to our presentation just as much as we've enjoyed working on it throughout the semester. This slide and the slides following will contain our references that went along with this presentation. Thank you, and I hope you enjoyed.